Hello everyone. So today in this presentation we will be going to learn about the topic as cited here, the visual impairment. So in this topic we will be going to learn about its causes, that is also known as the etiology of visual impairment. Before moving on to the etiology of visual impairment, I would like to cite what is visual impairment. A visual impairment refers to when you lose part or all of your ability to see. The impairment must persist even with the use of eyeglasses, contact lenses, medication, or surgery. A visual impairment is any visual condition that impacts an individual's ability to successfully complete the activities of everyday life. Students with visual impairments are infants, toddlers, children, and youths who experience impairments of the visual system that impact their ability to learn. Now we shall discuss the etiology of visual impairment. So by now you have been cleared what is visual impairment, and for that purpose we can discuss now what are the various causes of visual impairments. The first one is the errors of refraction. Second, glaucoma, cataracts and diabetes. Third, prenatal causes. Fourth, improper muscle functioning. So now moving on to the first subtopic or the first cause of visual impairment, that is errors of refraction. The most common visual problems are the result of errors of refraction. It includes myopia, hypermetropia and astigmatism. So myopia is also known as nearsightedness, hypermetropia is the farsightedness, and astigmatism is the blurred vision. These all diseases are the examples of refraction errors that affect the central visual acuity. So when the eyeball is too long, the light rays from the object would be in the focus in front of rather than on the retina. This results in myopia, which affects vision for distant objects, but close vision may be unaffected. Next is hypermetropia. When the eyeball is too short, the light rays from the object would be in focus behind rather than on the retina. This results in hypermetropia, which affects vision for close objects, but far vision may be unaffected. Then the cornea or the lens of the eye is irregular. The light rays from the object would be blurred or distorted. This results in astigmatism and is also known as blurred vision. So for these causes can be rectified by using glasses or contact lenses. Moving on to the next cause, that is glaucoma, cataract and diabetic retinopathy. So glaucoma is a condition in which there is excessive pressure in the eyeball. If left untreated, the condition progresses to the point at which the blood supply to the optic nerve is cut off and blindness results. The cause of glaucoma is presently unknown and its onset can be sudden or very gradual. A common complaint during early stages of glaucoma is that lights appear to have halos around them. Next is cataract. Cataracts are caused by a clouding of lens of the eye, which results in blurred vision. In children, the condition is called congenital cataracts. It affects distance and color vision seriously. Surgery can usually correct the problems caused by cataracts. Then the last is diabetic retinopathy. So, diabetic retinopathy is caused by diabetes. When there is interference with the blood supply to the retina, this condition occurs. Looking forward for the third cause, that is prenatal causes. So there are several other visual impairments that primarily affect children. Visual impairments of school-age children are often due to prenatal causes, many of which are hereditary, like congenital cataracts and glaucoma. There are other congenital conditions. First is GLAUCOMA, that is another congenital condition which is a degenerative disease in which the central and or peripheral areas of the retina are not completely formed. This results in impairment of the visual field and or central visual acuity. Next is retinitis pigmentosa, and in this case it is a hereditary disease resulting in degeneration of retina. This causes the person's field to vision to narrow, and it also include the infectious disease that affect the unborn child, such as syphilis and rubella. Now we will be discussing the last cause, that is improper muscle functioning. In this improper muscle functioning, there are the two conditions which result in visual problems. First is strabismus and the second one is nystagmus. So the first, strabismus, is a condition in which the eye or eyes is or are directed inward or outward. If it is left untreated, strabismus will result in permanent blindness because the brain will eventually reject signals from a deviating eye. Fortunately, most cases of strabismus can be corrected with eye exercise or surgery. Next is nystagmus. It is a condition in which there are rapid involuntary movements of the eyes. This results in dizziness and nausea. Nystagmus is sometimes a sign of brain malfunctioning or inner ear problem. So, by now we have known the various causes that lead to the loss of vision impairment. We can conclude that most of the causes of vision impairment are related to age, diseases like cataracts, uncorrected errors in refraction, diabetic retinopathy, eye injuries, glaucoma, prenatal causes, and improper muscle functioning. So, we can also prevent the visual impairment by following a healthy lifestyle, knowing our family's history for any eye problem, and most importantly, children should have regular eye examination. This is because it is very important that visual problems are diagnosed early so that learning and other developmental problems can be prevented. So I hope the etiology of visual impairment is clear to all. Thank you.